The world is teeming with invisible threats, lurking in places we often overlook. These threats are not from outer space or science fiction, but from our very own planet. They are very real, and they originate right here on Earth in the ecosystems we share with countless other species. We call them zoonotic diseases, a term that signifies their animal origins. These diseases hide in the bodies of animals, often without causing them any harm, silently waiting for an opportunity to jump to humans. But when these diseases jump to humans, they can unleash chaos, disrupting lives and healthcare systems. Think Ebola, HIV, and now Mpox. These are just a few examples of zoonotic diseases that have had devastating impacts. These are not just isolated incidents, they are part of a larger pattern. They are stark reminders of our interconnectedness with the animal kingdom and the delicate balance we must maintain. And they highlight the urgent need for understanding and vigilance in our interactions with animals. Zoonotic diseases represent a significant portion of emerging infectious diseases, posing a constant threat to global health security. They pose a constant threat to global health security, challenging our preparedness and response capabilities. These diseases can quickly spread across borders, overwhelming healthcare systems and causing widespread panic, as we've seen time and again. The economic and social impacts can be devastating, affecting every aspect of our lives. It is not just about containing outbreaks when they happen, it's about proactive measures. We need to focus on preventing them in the first place through research and conservation efforts. Understanding where these diseases come from is crucial. Many originate in wildlife, where they exist unnoticed. Animals like rodents and bats often harbor viruses without showing symptoms, acting as reservoirs. These animals often live in close proximity to humans, increasing the risk of transmission. This creates opportunities for these viruses to spill over into human populations, leading to potential outbreaks. We must remember, we share this planet with countless other species, and sometimes that sharing comes with risks that we must be prepared to manage. The name Monkeypox is a bit of a misnomer. While monkeys were the first animals identified with the disease, they are not the primary source of infection for humans. The name can be misleading, causing people to think monkeys are the main culprits. In fact, the virus likely originates in rodents. These small mammals often carry the virus without showing any symptoms, making them silent carriers. They then transmit it to other animals, including monkeys and occasionally humans. This chain of transmission highlights the complexity of the virus's spread. Mpox is a viral disease. It belongs to the same family as smallpox, known as the Orthopoxvirus genus. Although less deadly than smallpox, Mpox still poses a serious health threat. Its symptoms can be severe and long-lasting. It can cause debilitating symptoms and even death, especially in young children and individuals with weakened immune systems. Vulnerable populations are at higher risk. The virus is a reminder that seemingly distant animal diseases can quickly become a human problem. Zoonotic diseases are a growing concern in global health. The current outbreak of Mpox has raised global concerns. Public health officials are closely monitoring the situation. While not as easily transmissible as respiratory viruses like COVID-19, Mpox spreads through close contact. This includes skin-to-skin contact and bodily fluids. This includes contact with infected animals or humans, as well as contaminated materials. Proper hygiene and sanitation are crucial. The virus can enter the body through broken skin, respiratory droplets, or mucous membranes. Awareness of these entry points is essential. This makes understanding its transmission routes critical in preventing further spread. Education and awareness are key to controlling the outbreak. Mpox is not a new disease. It has been known to scientists and researchers for several decades. It was first discovered in 1958 in research monkeys during a study on polio vaccines. The first human case was identified in 1970 in the Democratic Republic of Congo, marking a significant moment in medical history. Since then, Mpox outbreaks have been reported sporadically in Central and West Africa, affecting various communities. These outbreaks were primarily linked to contact with infected animals or their bodily fluids, such as through bites or scratches. For decades, Mpox remained largely confined to these regions with limited spread beyond. However, the situation changed dramatically in 2022. An unusual outbreak occurred in non-endemic countries, primarily in Europe and North America, catching many by surprise. This outbreak differed from previous ones in several ways, including its rapid spread and demographic impact. It primarily affected men who have sex with men, highlighting the need for targeted public health interventions. It also showed limited links to travel to endemic areas, suggesting other modes of transmission. This suggests sustained human-to-human transmission, which was a new and concerning development. The 2022 outbreak highlighted the potential for Mpox to spread globally, beyond its traditional boundaries. It also emphasized the need for heightened surveillance, rapid response measures, and international cooperation. The World Health Organization declared the outbreak a public health emergency of international concern, a rare and serious designation. This declaration underscored the seriousness of the situation and called for international collaboration to contain the virus, ensuring global health security.